Hello everyone, my name is Brittany Horton and I'm a mechanical engineering student at Virginia Tech. I am absolutely obsessed with medical devices. I read this before bed every night just to get a little inspired, and I want to share my passion with you. So I will be talking about transcatheter aortic valve replacement surgery. I know this is a long, scary name, but don't get scared off already. We will call it TAVI surgery for short. And this is just a minimally invasive type of heart surgery. First, it's important to realize why someone would be having heart surgery in the first place. Well, one reason is because of aortic stenosis. And aortic valve stenosis is the most common valvular heart disease in the West. So it's super common and affects a lot of people. And it's the result of calcified material gathering on the leaflets of the heart. This calcified material is similar to the plaque that we get on our teeth.
In a properly functioning heart, 3 leaflets open when blood is pushed into the aorta and closes when the left ventricle expands to prevent backflow. To picture this, you can think of the valves as swinging doors and the blood as people. When the door opens, the people rush into the aorta, and then the door closes, and the other door opens. Since the doors can only swing one way, the people can only move this way, and not back through the way they came. In a calcified valve, the plaque on the leaflets prevents the valve from closing all the way. Thus, leakage is allowed through the valve. Going back to our analogy, if the first door had something on it that prevented it from properly closing, people could sneak out through this first door. This leakage is called backflow.
The first treatment for this type of heart disease was an open heart surgery called valve replacement surgery. There are a lot of complications that can arise from this, such as infection and a long recovery time. An engineer looked at these problems and said, I can do better. And he did. He created TAVI surgery.
TAVI is a minimally invasive method of repairing the inoperative valves. During a TAVI surgery, the surgeon inserts a catheter through the transfemoral artery, the transapical artery, the subclavian, or directly through the aorta, depending on the person's artery sizes and the personal preference of the surgeon. The balloon is then inflated, pushing the calcified valves to the side, and the stent is put into place. This stent holds the aorta open and has leaflets attached to it. These leaflets are not native to the patient and are usually made out of porcine, which is pig, or bovine, which is cow, pericardium. And pericardium is just the sac that surrounds the heart. The pericardium is used because it is the optimal thickness for these valves. Since the surgery is minimally invasive, the risk of infection decreases and the postoperative discomfort is reduced. And now that you know one of the minimally invasive options for heart surgery, maybe you will be the next to take it a step further and design a non-invasive way to treat aortic stenosis.